Hey everyone, it's me, your favorite naturopath, Dr. Whimsy, and today we're having a conversation about menopause and the signs and symptoms of menopause. The question being, am I entering menopause? Am I starting to begin the process of menopause? And how would I know? How would I know if I am entering menopause? So we're going to have that conversation today. And we're going to talk a little bit about how a naturopathic doctor would do an assessment on a patient who comes into the office and thinks that, in fact, she may be starting to experience changes in her hormones. So we want to first establish some terms and explain what menopause is. Menopause is that period in a woman's life when she has not had a menstrual cycle for a year. So if you have not menstruated for a year, you can say that you have entered menopause. This is very different than, say, somebody who has a medical condition or is underweight. We're talking about a woman who is, say, 52 years old and her last menstrual cycle was a year ago. From the time of her last menstrual cycle, she counts a year, we can now say that she has entered menopause. So getting to being officially in menopause is an interesting process, and we see interesting changes when we look at a person's lab work to determine if that is starting to happen. Usually in somebody who comes to see me, she's starting to experience some symptoms. I would say the first symptom that women complain about is hot flashes. Hot flashes usually can occur just as we're starting to see the ratio of progesterone and estrogen changing. A little bit about hormones. Let's talk a little about a natural 28-day cycle. If a woman is having if she's counting the first day of her menstrual cycle, the first day she sees that she's menstruating is day 1, to the next menstrual cycle is about 28 to 29 days. That process, certain things are happening in the body. Inside the pineal gland, which is a gland that sits in the brain, the woman's brain, the pineal gland, begins to release something called follicular stimulating hormone. And this basically allows for estrogen to rise in the ovaries. Estrogen begins to rise. And estrogen is a growth hormone. It does several things in the body. It helps with bone growth. It also helps with the growth and formation of the ovum. In addition to follicular stimulating hormone, you will then begin to see a rise in luteinizing hormone, comes after that. That is the first phase of the menstrual cycle, and we call this the follicular phase. And that usually runs about 0 to 12 days, 12 to 14 days on a natural cycle. We're having this follicular phase, so we'll see an elevation first of FSH, and then LH. Estrogen will begin to rise. And around day 11, 10, 11, you'll slowly begin to see a rise of progesterone. This is a normal cycle until you enter what's called the luteal phase, which is the second half of the ovulation or the natural menstrual cycle of a woman. And that luteal phase will see what's known as the progesterone surge. Now, when a woman is perimenopausal, and that is the approximately, give or take, 10 years prior to menopause, that is when she enters perimenopause. Usually in the United States, it's about age 40, 41. We start to say a woman is perimenopausal. That is when we start to see changes in this natural 28-day cycle. For example, we might see that the progesterone surge that is supposed to start to we see that natural rise of progesterone happening. It slowly starts to creep up, usually around 10 or 11, and then surging after day 14. We may not see that surge. This is something that we can find out about when we do hormone testing. Now, what's going on in terms of symptomology? If you don't ovulate, you may see changes in the menstrual cycle, because that progesterone surge usually indicates that ovulation has happened. Progesterone is produced by the ovum, by the egg. It continues to rise. If a woman got pregnant, she would become pregnant usually between days 10 to 13, maximum 14 is usually the time when most women are fertile. That egg would travel through the fallopian tubes. It would implant in about days 7 to 10. Hopefully you're checking this all out in these graphs I'm showing you. And that progesterone is coming from that the corpus luteum. That is what's going on there. Now, when those hormonal changes happen and we're not seeing a natural cycle that would indicate being capable of an ovulation, being fertile, you might see a shortening of the menstrual cycle as one of the first symptoms. So because you never have that luteal that surge, that progesterone surge, you might start to see yourself either having longer menstrual cycles or shorter, particularly towards the end of menopause. We'll start seeing women who they'll start to get a 26 day cycle approximately. That is because that progesterone has not surged. Other symptoms, one of the first symptoms I often will see is hot flashes. I think I mentioned that already. That's the person who's rushing to work. She has a cup of coffee. Sometimes it can occur as early as her late 30s. And all of a sudden she feels overheated. That can be one of the first symptoms of menopause. Vaginal dryness or uncomfortable during sexual intercourse. If there's pain on intercourse, that can often be a symptom. Thinning of the hair, particularly what we call male pattern baldness, thinning on the sides. That can sometimes happen because as estrogen levels decline, the protective properties of that estrogen decline, and we start to see that male pattern baldness due to testosterone not being opposed. Testosterone breaks down into DHT, and DHT is what we associate with male pattern baldness. Mood changes, sleep disorders, sometimes insomnia at night, particularly if a woman is having hot flashes at night. Frequent thirst, gas, bloating, and upset stomach, very common. I cover this a lot in my blog. I've written quite a bit about this. Changes in weight, also very common. Abdominal weight gain, very common. That weight gain that we associate with menopause. So what do we do about it? Well, usually if you're coming to see a naturopath, we'll do a thorough intake. If the woman has had a surgical menopause, that can happen if she's had a surgery, she's had her ovaries or uterus removed. We have to have a conversation about why she's in menopause. Is it surgical? Women post-chemotherapy, some medications, cancer medications, that can also cause changes in the hormones. So we need to find out what the unique needs are of the patient. Why is she coming to see us? And do a thorough intake questionnaire to find out what kind of symptoms she's having. I do the saliva test. I've talked about this in previous videos. I personally use the Labrix, but there are other companies out there. I get good results. And I also check the cortisol 24 hours just to see if we're looking at adrenal fatigue. So I like to get that complete adrenal panel to start off. I will be checking things like DHEA, which is a precursor hormone. That DHEA, which is made by the adrenals, goes on to make the other sex hormones as well. And cortisol, which should have a natural cycle, or what we call a natural circadian cycle. We check that to find out if any changes in weight are due to changes in cortisol. We also, of course, want to check progesterone, estrogen. Other tests I like to have done, a preliminary test, the first testing when a patient comes to see me, is I will check thyroid. I have not talked a lot about this, but since this is a channel that talks about healthy from 40, 50, 60 beyond, I want people to understand that as we age, our organs age as well, and that includes the glands that produce certain hormones. Our thyroid gland, which produces thyroid hormone, it can decrease in, the function may decline, so we want to check thyroid hormones, make sure that they're still functioning optimally. Pancreatic function can decline. This is one of the reasons why digestion can become more of a challenge as we get older. All of those things have to be taken into consideration. And then once we have those labs, the patient comes in for a follow-up. We've got those labs. We've done a physical, we've done an intake, and we've done a physical exam. At that point, we can talk about how we're going to supplement. I do usually start a patient on a protocol pretty early on. That first appointment, I've already got a pretty good idea of some of the supplementation, but I really don't want to be prescribing any hormone replacement until I get those labs back. So that is the story about how we get to the follow-up and towards treatment. I like to start with nutritional support and diet before anything else. Make sure that my patients have an optimal diet, optimal nutrition, supplementation when necessary. I do like multivitamins, but I want them to be high-quality multivitamins. Contrary to a popular myth, they don't wind up being peed out. If your pee is changing when you after you take vitamins and you're taking a high-quality vitamin, what you're peeing out are what are called metabolites. The vitamins have been processed, they've been stored in the liver or sent to the tissue they need to be sent to, and then the parts, after they've been processed, the parts that are not needed are eliminated. That's the change in color that we sometimes see. Sometimes we take more vitamin than we need, for example, above 100%, and the reason for that has to do with sometimes having a challenge with malabsorption or maldigestion, or simply whether or not that particular nutrient can be absorbed easily. So that is the first phase, is vitamins, nutrition, supplements. The next phase is herbals, and we always want to make sure that the patient is not on any medications that might not be, it might not be a good idea to go on certain herbals depending upon the type of medication that the patient is on. Sometimes there are simply drug-herb interactions. Sometimes an herb will clear a medication. So a patient goes on a particular medication, we want that medication to do its work. If I give herbals that clear the medication from the body, it can't do its work. So you really want to go with a trained naturopath that understands drug-herb interactions. And then finally, the next phase, after we've made sure we've done all of that, done the herbals, is we move on to bioidentical hormones, and that's usually my last choice. And that is because I think in the early phases, perimenopause, menopause, people may be able to do just fine on supplementation and herbals. However, as we get older, we may want to have that conversation with patients about the benefits of bioidentical hormone replacement as well. So that about wraps up this conversation about menopause. How do we know we're in menopause or entering menopause, and what do we do about it? I hope you enjoyed listening to this video. My name is Dr. Whimsy Anderson. Be sure and share, like, subscribe, and ask me any questions you like about naturopathic medicine. I'm here to help. I'm also going to link below to the American Association of Naturopathic Physicians if you would like to find a trained, licensed naturopathic doctor in your area. Thanks for watching. Bye-bye.